How does this virus spread? Is there a treatment available for hepatitis? Does this virus spread in family? Hi, I am Dr. 𝗵𝗵𝗃𝗁𝗍𝗔, Senior Consultant Gastroenterologist and Hepatologist at Zen Multispeciality Hospital, Chembur. Today, I will discuss about hepatitis B, one of the commonest cause of liver damage other than alcohol in our country and the world. Around 2 to 4% of population of India is infected with hepatitis B. Why is it important? Because it is one of the important cause of long-term chronic liver damage. It can develop into cirrhosis and it can also develop into liver cancer. How does this virus spread? This virus spreads through blood and blood products. So if a person comes in contact with infected blood or blood products from a hepatitis B positive individual, he can get the virus. So the ways are unprotected sexual intercourse, sharing of needles, especially if you are using IV drugs, sharing of toothbrushes, sharing of razors, occasionally tattooing or dental procedures done by unhealthy or unsafe instruments. Also, sometimes receiving blood and blood products, especially if you have received them before 1992, because those were the time when hepatitis B and C were not tested routinely before transfusions. Another important reasons medically is if you are working in a medical environment, then you can get exposed to these patients in your routine day-to-day activities and get the virus. One of the commonest reason of hepatitis B in our country is transmission from pregnant mothers to their children, or what is called as mother-to-child transmission. Hence, it is necessary that all pregnant ladies be tested for hepatitis B virus, because if they are detected positive and timely measures taken, we can prevent the transmission to the child. How does hepatitis B present? Well, it can present in an acute way in the form of fever, jaundice, body ache, but that is not very common. What we commonly see is the chronic long-standing hepatitis B, which is present. Many of these individuals are asymptomatic, that is, they don't have any symptoms detected either during pre-employment or a routine health checkup. But it is important to know that the virus can get activated later in life. So once you are detected to be hepatitis B, you have to follow certain precautions, certain instructions and regular health and blood checkups as advised by a doctor. How do we prevent hepatitis B? Well, hepatitis B can be prevented. One very important thing is vaccination. Hepatitis B vaccination is safe, it is cheap and is widely available throughout our country. 3 doses need to be taken during a duration of 6 months, and it gives you almost 95 to 98% protection against the virus. Because of the same reason, the Government of India has made it compulsory that all newborn children which are born are vaccinated for hepatitis B. Is there a treatment available for hepatitis B? Some patients ask. Well, there is no treatment to cure hepatitis B completely, because once the virus is positive in your blood, 99% chance that it will stay with you throughout your life. So what can we do for it? Well, there are drugs available now, safe, effective, cheap drugs available. In many states, it is provided free by the Government of India initiative, which can be given to the patients, and the viruses can be kept under check. Many patients have this query: does this virus spread in family? Well, it does not spread through common activities like sharing of utensils, sharing of clothes, hugging each other. This only spreads love, does not spread hepatitis B, but it can spread through using of shared toothbrushes and shared razors, which need to be avoided. So if you have a history of blood transfusions in the past, you have taken tattoos or have taken injections from unsafe places, shared needles, please get yourself tested for hepatitis B, because if it is positive, you can prevent the spread in the community as well as prevent the growth of virus in your own body. Thank you. This video is for educational purposes only. If you develop any symptoms related to liver disease, please see your nearby or regular consultant at the earliest.